One of the most widely used and widely recommended nutritional supplements is something called omega-3 fish oil capsules. Well, like almost every other supplement, fish oil is a little bit controversial. Is fish oil the cure-all for heart disease and Alzheimer's? Or is fish oil the new snake oil? I'm Steve Goldring from simplehormones.com. I help patients and healthcare practitioners with easy-to-understand patient education resources. Most of those resources are about hormones and hormone optimization. A little while back, I posted a video about my experiment in reducing my own ApoB. That's a very important heart risk factor. And now I'm talking about fish oil supplements and omega-3 fatty acids. Those topics aren't exactly about hormones, but hey, it's my channel and I can talk about whatever I want to, right? It's all long-term health and wellness related anyway. In this video, I'll go over what fish oil is, and I'm going to focus on the two specific kinds of fatty acids that make up most of those fish oil capsules. We'll talk about the evidence, especially as it relates to heart disease and neurodegenerative diseases like Alzheimer's. What can we say about fish oil and its components? And what can't we say about fish oil? What is fish oil? Fish oil capsules come from several different types of fish, of course. Salmon, sardines, anchovies, and others. They're mostly a mixture of two different fats. They're called omega-3 fatty acids. The two fats that are most prominent in fish oil are the two fats that are most prominent in fish oil are docosahexaenoic acid, DHA, and icosapent acid, EPA. Whew, I got them right. There's a lot we can say about EPA and DHA, but there are also some things that we can't really say, at least with a high amount of certainty based on the research. So I did a couple of searches on PubMed, which is a database of a lot of scientific studies. We can say that omega-3 fatty acids reduce inflammation. Omega-3's ability to reduce inflammation makes them look pretty promising for both Alzheimer's disease and heart disease. In the brain, we can say that omega-3 fatty acids increase the level of brain-derived neurotrophic factor, or BDNF. BDNF is a protein that helps your brain build new neurons. It helps build new brain cells and neural pathways. I've heard somebody recently call BDNF brain fertilizer. Omega-3s, especially DHA, may help older people maintain their cognitive function. But DHA hasn't really helped people who already have Alzheimer's when it was given in clinical trials. DHA levels are higher in brains of people without Alzheimer's than it is in people with Alzheimer's. There seems to be a problem with DHA in people who have APOE4. That's a gene that makes you more likely to get Alzheimer's, much more likely. APOE4 also seems to decrease your brain's ability to either get or use DHA. Omega-3 fatty acids are helpful for people who have had concussions or brain injury, and that's also a big risk factor for Alzheimer's. We can say that of the two omega-3s, DHA is the omega-3 that seems to be most helpful for the brain. But EPA seems to be the one that's more helpful for the heart. We can say that omega-3s have been shown to reduce triglycerides up to 15 to 30%. That's another one of those important heart risk factors, along with ApoB, Lp(a), C-reactive protein, insulin resistance, and others. A large randomized clinical trial called REDUCE-IT used a purified form of EPA called Icosapent Ethyl on patients with a risk for heart attack. Icosapent Ethyl is available in a brand name prescription drug called Vascepa, as well as a generic form. A little side note here, there's also a second prescription strength fish oil. It contains both EPA and DHA. That one's called Lovaza. I'm not going to talk a lot about that one in this video. Back to the REDUCE-IT trial, they randomized 3,146 patients and had some of them take Vascepa and some take placebo and followed them for about 5 years. Compared to placebo, patients taking Icosapent Ethyl had less heart attack deaths, non-fatal heart attacks, and non-fatal strokes. Dramatically, patients who took Icosapent Ethyl died less often than patients taking the placebo. That's called all-cause mortality, and it's a big deal. This derivative of EPA didn't just lower people's numbers like their triglycerides, it also seems to have actually saved some of their lives. So is Icosapent Ethyl the same as fish oil? Kind of not. Fish oil capsules contain a much lower dose of EPA than patients were given in the Reduce-It trial. Icosapent Ethyl is a purified form of EPA that's not exactly the same as what's in fish oil capsules. So we can say with some degree of certainty that Icosapent Ethyl shows real promise in reducing heart disease risk, but we can't say with certainty that fish oil capsules also reduce heart disease risk, at least not based on the currently available research. I suppose a randomized clinical trial of high-dose EPA or fish oil capsules might be able to tell us, but it's pretty unlikely that anybody's going to be willing to pay for an expensive study like that. We can say that the safety and side effect profile of Icosapent Ethyl is extremely good. It's comparable to placebo. People tolerate it very well, which is to be expected because fish oil capsules also don't have that many bad side effects. Speaking of side effects, it's possible the main one might be fish burps from fish oil capsules, especially if you buy really cheap ones. I take a pretty reputable brand and have never once had fish burps. You can get a few side effects in the GI tract, like an odd taste in your mouth, constipation, diarrhea, gas at either end, heartburn, reflux. My wife gets that from fish oil. Indigestion. Some people get a rash or itching on the surface of their skin, maybe indication of an allergy. People who have a bleeding disorder or who take medications for blood clotting like warfarin might experience some bleeding problems with fish oil. If you're on blood thinners or you have a problem with too much or too little blood clotting, you'll definitely want to make sure your provider knows about any fish oil you take. Overall, though, the side effects of fish oil are mild and manageable for most people. You can take fish oil capsules for several different reasons, and I would say feel pretty good about that decision as an anti-inflammatory to reduce whole body inflammation, including the inflammation in your blood vessels, your heart, and your brain. You can take them as something that can increase BDNF, so-called brain fertilizer. You can take fish oil as a way to bump up the level of DHA in your bloodstream and possibly in your brain, especially if you don't have Alzheimer's, it might help your cognitive function. You can take them as something that can reduce your triglycerides as much as 15 to 30%, even though you won't really know whether that's going to result in a reduced heart risk. You can take fish oil as a supplement that might help reduce your blood pressure in certain studies. As a supplement that might raise your HDL cholesterol. Higher HDL is better for your heart. It's a supplement that could keep plaques in your arteries from hardening or beginning to block those arteries. Of course, you can get fish oil from, fish. Eating fatty fish with low levels of heavy metals and toxins is really a great way to get omega-3 fatty acids. The only difficulty, though, is that it's hard to get enough omega-3 fatty acids from just eating fish. My wife and I eat salmon 3 times a week. I think we're having salmon tonight. And we eat sardines every week or two, but we also supplement with fish oil capsules in order to bump up our EPA and DHA. You can get omega-3 fatty acids from algae oil, especially if you're a vegan or vegetarian. You need to be aware that is a practical matter that algae oil just has less DHA and EPA in it. You're probably going to take about twice as many algae oil capsules as you do fish oil, and it's going to cost you probably twice as much. I wanted to share my most recent lab report that shows what my omega-3 levels have done, especially with fish oil supplements. It looks like my DHA is in the high normal range. I'm at 303 and a high is 365. I'd love to bump that up a little bit more. My EPA is at 542 and the range only goes up to 130. And I feel pretty good about that. I'm also looking to get the ratio of my omega-6 to omega-3s as low as possible. If you've heard anything about inflammatory seed oils, that refers to soybean oil, canola oil, vegetable oil. Those oils are mostly omega-6 fatty acids, and you might want to try to reduce those. If you're not planning to get a prescription version like Lovaza or Vascepa, but you'd still like to get a fish oil omega-3 fatty acid supplement for yourself, you'll definitely not want to buy the cheapest one. Well, I've got nothing against big box stores like Costco or Walmart. I go there all the time, but I don't buy my fish oil there. What I look for is a reputable brand that's certified by a third party. A couple that I trust are International Fish Oil Standards, or IFOS. There's also the Global Organization for EPA and DHA Omega-3s, GOED. These certifications guarantee fish oil passes a bunch of tests for omega-3 concentration. Is it consistent with the label, what's in the capsules? They test for oxidation standards. Oxidation is a breakdown of the omega-3s that actually makes them almost toxic. Speaking of toxic, we also want to test for chemical toxins like PCBs in fish oil, and we want to test for heavy metals, and there are a bunch of other testing categories. If this video has been helpful at all, click the like and subscribe buttons, and click the little bell to get notified anytime I post a new one. Thanks so much for watching, and I'll look forward to talking to you again next time, whether it's about hormones or some other wellness and long-term health topic.